Welcome to a Healthcare Packaging Editor Roundtable from PMMI Media Group.
Hello, and welcome to today's talk about some of the thoughts and concerns that have come up in terms of manufacturing COVID-19 vaccines and treatments. I wanted to reach out to some of the editors over at PMMI Media Group just to chat about some of the things we've recently been covering. So I'm Keren Sookne. I'm the content director at Healthcare Packaging Magazine, and I'm here with Stephanie Neal, editor-in-chief of OEM Magazine, as well as Aaron Hand, who is editor-at-large with a number of publications, including Healthcare Packaging, Automation World, and more. So we've been covering manufacturing and supply chain pretty much nonstop, so I just wanted to get right to the questions. Aaron, I wanted to start with a story that you recently wrote about the rise of cyber attacks, and specifically, what does COVID-19 have to do with cyber attacks?
Sure. So this story was driven by a presentation from McKesson. That was a webinar put on by Healthcare Distribution Alliance. And so it focused specifically on healthcare distribution, but really this is relevant to any organization. And it's certainly relevant to COVID-19 right now because cyber criminals are basically going to take advantage of any sort of emergency or heightened sense of fear. They're going to exploit people's fears. So we've been seeing the numbers rise. I mean, I'm reading things every day about all of the phishing attempts with cyber attacks. So McKesson had talked specifically about that rise in cyber attacks. Zscaler is one company I've been getting emails from that mentioned there were about 1,200 COVID-related phishing emails in January. Mm-hmm. That number had risen to 380,000 by March. And Google was actually reporting in early April 18 million phishing and malware scams related to COVID-19 specifically a day.
Wow.
Every day. So it's a huge issue. Cyber attacks in general have really grown into a profitable business. It's one business that's doing particularly well during COVID-19, and you can't say that about a lot of businesses. Mm-hmm. It's a very sophisticated business model. So you may have teams that are going in and figuring out where they can attack, and they sell that information to maybe another team that actually performs the attack. Not everybody wants to take that particular risk on. But it doesn't matter who you are. You don't have to be, a big fish in the sea to be attacked. It's a lot of random hits. They're going to hit whoever they can because they're there to make money. Usually the ransomware attack is later in their process. They've been fishing around in your system for a while. So there are things you can look out for in terms of, strange network activity. Anybody can be mindful of what are your policies in your company as far as, does your company allow you to log into the system without the two-factor authentication, where they'll send you a code by text or email or that sort of thing in addition to your password. So there are certainly things that you can be looking out for.
So those are the specific things that companies should do if they're attacked by ransomware, or those are things that they can help detract or prevent an attack?
Well, yeah, those are things that any individual, whether you're in charge of cybersecurity or not, you can, if you've been able to use your same password for the last 10 years, you might want to flag that for your company. But there are other things that a company can do specifically if they are attacked by ransomware. The first is do not turn off that system. I think that's a very natural impulse. It's like, oh my gosh, we were attacked. Turn it off, hurry. And that's absolutely what you should not do. You should disconnect it from the network. But if you turn off that system, then you're going to lose all of that forensic information that the cyber experts, the cybersecurity experts would be able to use to figure out where that attack came from, that sort of thing. So you should get in touch immediately with your cyber team, whether that's a team or whether you have just an individual to go to, say, an IT department. you want to put warning signs up on all those systems. Since you are not turning them off, you want to make sure that nobody is using those systems or logging into those systems. And one thing that all companies will need to think about right away is their messaging to the public. You don't want to tell the public immediately until you figure out what your message is, which would include your next steps, and to be able to give them assurances of what you're doing as a company to correct this cyber attack.
Right. And one thing I thought was interesting in your story was, making sure that you don't let it happen again, because you don't want to have to issue that PR statement, a few months or a year down the line saying, well, it happened again. So it's, it's a lot to think about.
Right. It's bad enough to have to say it once. But people can forgive once, as long as you show you're doing due diligence to correct it. But if you have to say it twice, they're not going to be as forgiving.
Right.
So Stephanie, I know that you had written recently about COVID-related items in terms of automation, and what those automation suppliers are doing to get a vaccine ready as we move toward that. Maybe you could talk about what some of the automation suppliers are doing?
Sure, absolutely. So, we're talking a lot about sort of general remote management type of technologies that are rolling out from these automation suppliers. But when we look at a vaccine specifically, and we look at that Operation Warp Speed, the executive order that was put into place as we were trying to accelerate the development of a vaccine, we have to take a step back and look at how the process has been traditionally, which is very tedious, regulatory heavy. It's step by step from the lab to clinical trials to manufacturing to distribution, and it can take years, 2 years. So recently Honeywell came out with what it's calling fast track automation, and it can take that 2 years down to 2 months. And it's not new technology specifically. It's using sort of the same stuff that they've always had, that's really important to pharmaceutical manufacturing, which is like batch control, but then it's wrapping into it more cloud-based, more compute power and flexible assignment to compute power, remote management. And key here is virtualization. So it's going to take that linear process and it's going to make it a parallel process. So while the clinical trials are in place and while that regulatory approval is happening, parallel to that, you can use the virtualization software to run the manufacturing processes to make sure that it's going to be manufactured safely and meet all the regulatory approval. You're also digitizing that data, so you have an audit trail. So that also makes it easier to get the, to meet the compliance and everything that's going to have to happen to get that vaccine out the door. So, the goal here is to meet that 300 million dosage of safe vaccine by January. I'm hearing even just this morning that we're getting close to maybe starting production, which fingers crossed. But this type of technology is really going to help accelerate that development.
Makes sense.
That sounds a lot like things that Honeywell and other automation suppliers are doing just in the general commissioning process for manufacturers. So I assume they're putting a lot of their expertise to use specifically to COVID then.
Yeah, I think if you take a look around, and you've been hearing the same message for years to get manufacturers to digitize their data. And the whole goal is because there needs to be more collaboration, there needs to be more flexibility, there needs to be more agility. And now all of these products and services that they're talking about is coming, COVID is the catalyst, and sorry to say, but it is. And now it's kind of forcing manufacturers to adopt this technology. And what we're seeing too is a little bit of a paradigm shift, because we're seeing the technology suppliers not just selling products, but they're selling services now. I recently just wrote a story about Rockwell, and of course they're teamed up with PTC, so they can do a lot of this really cool virtual reality stuff for training. And they're also offering analytics as a service. So we're seeing some different shifts in the way that automation suppliers are delivering their products and services. So the manufacturing, it's all well and good, but then you start to think about, all right, well, once we have the vaccine, how are we delivering it? The supply chain is a completely different animal. Keren, I know you've been covering the supply chain for a while. What's going on there?
Yeah, so one thing that kind of, I've been thinking a lot about is, and this particularly came up during the HGA distribution management series. Dr. Nicolette Louissant, she brought up that, natural disasters are becoming more frequent. And so it's kind of like how our brand owner is going to sort of weather this storm of both COVID-19 and, say, hurricanes, tornadoes, wildfires, things like that, things where typically people tend to congregate close together. And so how do you keep up your business continuity trying to manage these multiple threats? And then, there's the added sort of complexity that your suppliers are going to also be weathering those threats at the same time. So you really have to have a good relationship with like your telecom provider, make sure that your transportation and logistics providers are able to weather the storm with you. And there's just a lot to think about. And so the earlier that you think about, your hazard mitigation plans, the better. And I know that Healthcare Ready, which is Dr. Louissant, she's the CEO of that organization, has a lot of good information on their site. And I also wanted to point people to FEMA's Supply Chain Task Force, which are also working on this. They really have like a strong focus on making sure that that medical products are really included in part of this overall emergency management effort. So there is a lot to think about, especially as we try to think about concurrent hazards at once, which, hasn't necessarily always been the case. Usually you focus on one disaster at once and then you work on recovery. And so in this case, yeah, those overlapping hazards are just going to, require so much more effort, basically.
And do you think that's going to require that these companies bring in another level of expertise to help sort through all that?
It very well could be. I mean, I know that, there might be some need for additional risk management. And I believe there are consultants who will come in and sort of help you look at those outside factors. I used to personally work in risk management, but this was on the process safety side in oil and gas and chemicals. And so, we would come in and look through all of their blueprints basically and just look for hazards. And so, there are consultants who sort of specialize in this management area and can sort of help deal with possible blind spots or, might have relationships that could sort of help create plans.
Good to know. A lot to think about.
For sure. Oh, sorry, that was my little email noise that I thought I turned off. But I know everybody's super busy and we all have to get back to covering all these really important topics. So I just wanted to thank you guys, Erin and Stephanie, for coming on the call today and chatting with me. Appreciate it.
Yeah, thank you, Keren, for the opportunity.